This segment is brought to you by Busamed Pettipher Private Hospital.
Dr. Pettipher, thank you for joining us on Living Your Best Life.
Pleasure. Nice to be here.
So today we're going to talk about rheumatoid arthritis. So before we go any further, maybe we should just discuss it or define it for our viewers.
So arthritis is when your joints become painful and swollen and stiff. It normally starts over a slow period of time, and it progresses. It generally tends to involve your hands and your feet, but it can actually affect any joint. I think one really needs to understand there are lots of different types of arthritis. For example, you get osteoarthritis, which is a wear and tear arthritis, and then you get more specific types of arthritis like rheumatoid arthritis, and these are arthritides involving the immune system. So your own immune system is what fights infections, but sometimes your immune system for some reason starts to attack the linings of the joint, and that causes the pain, swelling, and untreated it really can lead to a disability. Patients can become crippled, may find it difficult to walk and do the normal activities of daily living. So this is a disease that potentially can really impact on your life.
Okay, so let's talk about rheumatoid arthritis in particular. What are some of the early signs and symptoms?
So patients will probably notice their knuckle joints in their fingers, what we call the metacarpal phalangeal joints, and their wrists. They will notice definite pain and swelling, and that doesn't go away. And normally, if it hasn't gone away after a couple of weeks, I think you pretty much know that it's not going to go away, and that's when it's really time to investigate. Another common place where patients experience discomfort is in the balls of their feet. But any of the toes underneath the feet, the pads of your feet, you will notice some difficulty or pain, discomfort. Patients may also experience fatigue. They notice that they're tired, they can't do the things that they are used to doing, and then of course they may very well wake up with stiffness of their hands. They may find that running them over hot water seems to help, or taking a hot shower, and that stiffness can often go on for an hour or so.
Okay. Is there any particular age group that this condition affects?
So it can affect any age group. If it occurs in children, we define it as juvenile inflammatory arthritis. But over the age of 16, we talk about rheumatoid arthritis, so it can affect anyone from a young age to old age. In fact, the most common age category is between the ages of 30 and 50.
Ek is Elise de Tooy, ek is 72 jaar oud en ek was 'n groot deel van my lewe met kinders gewerk. Ek het my eie kleuterskool gehad. Ek was baie aktief, saam met die kinders gespeel, en 2 jaar terug het my man 3 hartomleidings gehad en het 'n longoperasie gehad. Ek was gesond, ek kon hom versorg. Dit was vir my wonderlik geweest. Maar na die einde van die jaar toe het ek 'n probleem met my voet begin gehad. Ek het gedink is maar, of die fisioterapeut het gesê is maar miskien 'n Achilles tendon, en ek het behandeling fisio gehad, maar dit wou nie beter gaan nie, en so het ek by Dr. Pettipher beland, en na scans en sonars het hy vasgestel daar's 'n gewas in my regter enkel. Die operasie was in Oktober, en ek was omtrent 6 tot 8 weke in gips, wat ek glad nie op my regterbeen mag trap nie. En terwyl ek in gips was, het my hele linkerkant, my linkervoet, al my gewrigte aan my linkerkant begin seer word, en soveel so dat dit vir my moeilik was om te beweeg. Ek kon nie in die nag omdraai nie, ek kon letterlik nie beweeg nie. Toe is ek in die hospitaal opgeneem, en Dr. Pettipher het toe rheumatoïde artritis by my gediagnoseer. Ek het nooit in die verlede, ek het 70 jaar oud geword, en ek het nooit enige pyn of enige artritis gehad nie, maar hy het dit toe by my gediagnoseer.
Let's talk about some of the treatments available to patients, both conventional as well as maybe new therapies that are out there.
Okay. In general, the treatment for rheumatoid arthritis is medication. Most people like a natural option. They want a change in their diet, they want to maybe change their lifestyle, and they come with the expectation that they're obviously doing something wrong, and a change in that is going to make a difference. But realistically, it really doesn't matter too much what you eat. There are guidelines for the management of rheumatoid arthritis. They have been published overseas. We, in fact, have published our own South African rheumatology guidelines for the management of rheumatoid arthritis. And we generally start patients on a drug called methotrexate. Methotrexate is the anchor drug. It's the #1 drug in the world. And it's #1 because it's really affordable. It's convenient in that you take it only once a week, and generally it works very well, and the side effect profile is good. In other words, it's very well tolerated by most people, and surprisingly cheap, in the order of about 50 Rand a month. So that's really an affordable first line drug.
Dit was so geswel en dit was baie seer geweest. Ek was eintlik baie moedeloos want dit het dan nou so goed gegaan. Soveel so dat ek in 'n stryd gewees het om te bid om gesond te word. En my medikasie het sommer onmiddellik begin. En binne 'n maand wat ek dit gebruik het, kon ek reeds die verbetering voel. Ek kon snags opstaan, ek kon my voete van die bed afsit sonder pyn, ek kon beweeg, ek kon en geleidelik het die pyn verdwyn en kon ek maklik beweeg. En op hierdie stadium het ek na 4 maande se gebruik van daai medikasie het ek letterlik geen pyn nie. Ek voel soos 'n gesonde mens en ek kan voortgaan met my lewe.
So doctor, as a subject matter expert, what bit of advice could you give a patient living with arthritis?
So I think the aim is remission. The aim is to want to get your disease under control. I think you need to visit your rheumatologist on a frequent basis. You need to get onto the right medication and then make sure that it's properly monitored. And if there are any concerns, of course, that's chat to your rheumatologist. But in terms of your lifestyle, I think there are other things that you can do as well. We know, for example, that exercise really makes a difference. So patients with rheumatoid arthritis who exercise do better than those who don't. And in general, I think healthy lifestyle. So smoking is another habit that perhaps one should stop if you are a smoker, or you certainly shouldn't smoke if you have rheumatoid arthritis. The disease often is less responsive in smokers, and then of course smoking has other hazards including chest problems, and some of the drugs may even affect your lungs. They are immune suppressant drugs, so when you add perhaps lung injury from smoking plus the medication suppressing your immune system, there is an increased risk of infection. So I think smoking is something you should avoid, exercise is something you should do, and obviously nutrition, healthy diet certainly helps just to get your general immunity up. So lifestyle is important.
Perfect. Well, thank you so much for joining us today on Living Your Best Life.
Okay, thank you very much. Nice to be here.
Busamed Paardevlei Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Paardevlei Private Hospital offers their patients and their visitors the ultimate Busamed experience. Premium care, personal touch,